after a while, Hi, everyone. Thank you for joining. I think we'll just wait just a couple more minutes. I want to be cognizant of everyone's time, but I think we're waiting for John, just a few more people to hop on, so we'll get started in just a minute. Hi, John. I told everyone we would get started in just a couple minutes. We're just waiting for a couple more people to jump on.
Sounds good. Can you hear me now?
I can. How are you doing?
I am good. I am good. So we've had a couple of these conversations already. We've met with the Family Services group, and I met this morning with the Health and Nutrition group.
Oh, great.
Yeah.
How are things going so far?
Yeah, so I can share some of the things that those two groups discussed because there very well may be some overlap. But there were some interesting themes, a little bit of overlap between those two, but otherwise they've kind of got their own lists going. I see Christy is doubling up. This is her second one. So is it Marn or Marnie?
It is Marnie.
Marnie, okay. That's my wife's name, but she spells it I-E.
Oh, well, that's really neat because I don't know many people with this name.
Yep. Well, Tara, whenever you want to get started, we can get started.
Yeah, I want to be respectful of everyone's time. So let's go ahead and get started. I guess we'll start with introductions. I hope, John, I know you sent out some information to everyone. So just to follow along on our agenda, we'll start with introductions. My name is Tara Neimeister. I'm the Associate Director of Education in my organization. I work for Northern Kentucky Community Action Commission. So within my department, I have the education component and mental health and disabilities as well. We are a busy team of people, as I'm sure all of you are. If you want to just go around, I see Carla is the next person. If you want to introduce yourself. Oh, you're still muted.
I so want to get that shirt that says you are muted. I saw because our executive director, he's always saying that to us, you're muted, you're muted. I'm Carla Lambden, and I work for KCEOC here in Southeastern Kentucky. I'm the disability manager, and we service 6 counties. We serve like home base in more counties. But we have, several programs, and we've expanded our housing out into the Bowling Green in Western Kentucky. So like you said, you're busy. It's a busy time. They have a December 1 count coming up, and we are scrambling to get all this paperwork done. So I'm sure everybody else is in the same boat.
Jennifer, I see you next. If you just want to introduce yourself.
Hello, my name is Jennifer James, and I'm the Disability Mental Health Manager for Gateway Community Action, Gateway Head Start, and we service 10 counties. And yeah, it's very busy times. We have completed about 3 or 4 behavior meetings in the last 2 days, and working with, we have a new staff on board as well, trying to get everyone up to date with everything. So busy times.
Thank you. Does anyone want to go next? I see Felicia next on my screen.
Hi, good afternoon. I am Felicia Wheeler. I am Compliance Manager with Greater Louisville Head Start in Jefferson County. We have our center-based program and a home-based program, and we are serve currently right now about 285 children in our program.
Well, welcome. Anyone want to go next? I see Christy next on my screen.
Good afternoon, everybody. I work with LKLP Head Start. We serve 4 counties. I'm the Disability, Family, and Education Specialist, and I've been in this position for 6 years, and I've been with Head Start for 21.
Welcome. Who wants to go next?
I can go next. My name's Dawn Oak. I'm a licensed clinical social worker. I'm the mental health consultant for Carroll County Child Development School Center in Carrollton, Kentucky.
Welcome. Thanks.
I'll go next. I'm Christina Lowe. I am the Mental Health Services Coordinator for Audubon Area Head Start in Western Kentucky, and we serve 16 counties.
Thank you, Christina.
I'll go. I am Karen Mackey, and I also work at Audubon Area Head Start. I work very closely with Christina. I'm the developmental services coordinator. So I do all things disability. I also work very closely with behaviors and then with mental health with Christina. Very busy time. Lots of observations.
Go next. I'm Marnie Carter. I work with Murray Head Start, and I'm the Disabilities and Behavioral Health Services Coordinator. We serve 11 counties, including Scholar House of Paducah, Kentucky, and we serve Early Head Start, center-based and home-based, as well as partnership with the school districts for preschool Head Start.
Great. Is there anybody we missed?
I'll go next.
Okay. Hi.
My name's Angela Lucas. I'm the Disability and Health Services Coordinator for Breckenridge County. We have 115 Head Start kiddos, but we also run 3 other programs for about a total of 180 kiddos.
I'm Heidi Yard. I'm with Lake Cumberland Head Start. We serve 10 counties, 644 children, which include early, regular, pre-K, enhanced, and home-based. And we have migrant as well. And I am the Disability Service Area Manager. I've been with Head Start 21 years and in my current position for 13 years.
Welcome. Anybody else that hasn't gone? John, do you want to just take a minute to introduce yourself, even though I'm sure most people know who you are?
John Mountjoy. I'm with the Kentucky Head Start Association. So I'm the guy you call the association if you need anything. So, and I'm the one that gets these meetings going and kind of facilitates all of our activities.
Yes, we really appreciate John and all his organization of everything, keeping us up and running. You know, since we're still in the middle of a pandemic, full disclosure, I am home today. My daughter's childcare closed due to an exposure in the center. So I kind of strategically planned nap time during this time. She's 1, so she might get up. So I might have to rush off, but John is aware of that, so he might just have to jump in and take over. But we're going to move on and talk a little bit about the section's mission and objectives. So John, are you able to share that on the screen? So each section has kind of been charged with a general mission of how we're going to move forward and support programs and in each section's content area. So ours says that we're going to focus on mental health of children and families, including social and emotional well-being, building social and emotional capacity, and preparing for entry into elementary school. We're also going to do some work with IFSPs and IEPs and just the general mental health and well-being of our staff, which we know is a huge issue as well. A lot of our staff are sometimes in the same boat as our employees or as our participants in the programs that we serve at our agencies. So I know for my program, especially mental health for our staff and just burnout has been a huge issue. And just from the survey responses that John received back for this particular section, seems like it's a concern for a lot of you all as well. So I think we're going to talk about that a little bit today. John, do you have anything to add about just how these sections are going to work?
Sure. Many of you might have participated with KHSA in committees before, whether those were remote, whether they were a part of an annual conference, or whether you were just getting together with folks that shared responsibilities similar to your own. Just an opportunity for people to get together and sort of network and share problems and seek solutions. When I first came on board, I went to several of those committee meetings. And while I think that the networking aspects of the committee meetings were very good and people were meeting new folks and they were sharing ideas, the committees really weren't driving towards any particular goals. And I thought it was very important that each one of our committees, each one of our sections have a specific tasking, but also really focus in on 2 to 3 goals and objectives for the next 12 to 18 months. Really have some things that we can zero in on, whether that's training, whether that is trying to raise the visibility of certain issues, whether that's trying to address, whether it's mental health of staff, whether it's trying to raise involvement of parents, really trying to make some decisions about what are some things we want to focus on. Now, I will tell you that the Disabilities and Mental Health group, when we were revising the bylaws, working with the executive committee and that special working group, this group in particular, Disabilities and Mental Health, we talked about a lot. And the reason we did was it would be very easy for us to have a dedicated disabilities group or to have a dedicated mental health group. And we may find that in the future, we actually want to make that split and we actually want to go that direction. But we felt that at the outset, there were similarities enough between the disabilities and mental health functions that they would work well together for this purpose, at least starting out. The other thing that we discussed was you may have a desire, whether your emphasis is on one or the other, you may have a desire to want to focus on one set of issues over another. And so what we're trying to do in this particular group is have some balance. And so while we may not be able to tackle every single issue that everyone wants straight out of the gate, I want folks to know that we will get to the issues. It may not be the first thing that we tackle. It may be the fourth thing that we tackle. But I want to make sure that all of the issues get out there, that we have a record of them, and that we can begin to develop some work around it. So that's just a little bit of the background as to sort of how this group came around. So like Tara said, I had sent out a survey to all of the folks that have thus far signed up or been appointed to these particular sections. And so I really asked you 3 questions. The first question dealt with what did you see as the three major issues facing children and families when it comes to disability and mental health. The second question dealt with what did you see as the three biggest challenges facing staff when it comes to either disabilities and mental health as they affect staff or in the provision of services to families and children. And then the third question was sort of that pie in the sky, if you had a blank piece of paper, what would you do question, which is if you could fix any one issue in the disabilities and mental health sphere and you weren't encumbered by time, budget, or people, what would you fix? And so those were the three questions that we put out there to folks. So Tara, I'm going to pull up this first one. And this is, and once we go through these, I can share some that were identified by the other groups we worked with. So as you see, this is the first one, thinking about Head Start, disabilities, mental health, the top issues facing children and families. So Tara, do you want to go through them? Or you want me to go through them?
Sorry, I thought I was unmuted. If you want to go on ahead and go through them, that's great.
You know, the first thing that leaps out at us right now, and we all know this, is COVID-19, COVID, particularly when it comes to mental health related issues. And so we have seen that as a common theme amongst all of the conversations that we have had thus far. This particular group, though, this is where some of that may really rest, may really belong in terms of how it's impacting children and families, and then how it's impacting our staffs. We get into the traumatic events, lack of community resources, accessing developmentally appropriate mental health services, mental health as a whole. Again, here's one dealing with the limited resources. So these are the issues that people identified first. The second, stigma around mental health. The number of children in these areas is growing dramatically. The difficulty of having the resources to address, again, having access to those mental health resources in the community, homelessness and other issues, on-site disabilities, lack of awareness would be a big one. Again, COVID, routines at home, and then sort of the intake processes with other agencies, childcare, jobs. That was another really big one, and we'll talk about it in terms of recruitment and retention of staff. Education about social emotional learning, again, access to healthcare, mental health, disability services, infants and toddlers, lack of stable home and home employment and environment, consistent services, building relationships. So I think we see a couple of themes that exist in that particular area. Now, let me tell you some of the things that other groups had identified, because there will be some crossover. So if we think about our family services group as a whole, they really, I think, identified 4 areas that they want to sort of focus on. The first one is the vaccine mandate and staff retention, the impact that is likely going to have. Now, whether or not there are any real solutions for that one, I think remains to be seen, because we have not yet seen what OHS is going to be doing. But I know that Jeff Martin with Audubon had been at the Region 4 Board of Directors meeting a week or 2 ago. And basically what he shared was the folks at OHS said that any exemptions that come down for that are going to be extremely strict and narrow. So OHS is very towing the line, if you will, to the mandate. So that was the first issue that they had identified. The second issue dealt with staffing and pay. The section members sort of were interested in the compensation and benefit study that KHSA has attempted to do, and that we've just relaunched again, that hopefully that would be beneficial. Certainly, if you look at what they've got in some of the federal legislation right now, there could be a tremendous benefit if that legislation were to pass for Head Start staff in terms of pay. Professional development, they really zeroed in on burnout and how do we make sure that we're providing assistance to employees. The concern that a lot of people through training are getting certifications on Head Start's dime and then leaving, wanting to make sure that folks stuck around. And then the other one, and this was, it took us a little while to get to this one, with the family services group, but I think it's sort of an overarching one. Really making sure that family services and family engagement is integrated across the Head Start program, rather than thinking about what we do as being in silos, really making sure that there is full integration and recognition across every facet for family services. So that's what they sort of tackled. Now, the folks this morning in health and nutrition, they addressed a recruitment and retention. So again, you see that as a theme dealing with folks. We spent an awful lot of time on nutrition, and I think one of the reasons for that was the group felt that when it comes to traditional health, there are already a lot of programs and trainings and things that are out there for that. But when it comes to nutrition related issues, there may not be as much. And so much of their conversation focused around some of the nutrition challenges and then the need for training and professional development in that area. They talked about the need for sort of a mentorship, if you will. We had a couple of new folks that had just risen into that role of being the health and nutrition person. And so they were looking for advice, guidance, someone that they could really be in touch with. And I think that's sort of a good thing that has emerged here as sort of an unintended consequence or benefit, is that, here's a copy of our roster for this particular group right here. And not only does it have the name and where they're from in their email, but most importantly, it tells you who they are and what they do. And so when you're thinking about needing to reach out to someone, this list is only going to grow. And so we're going to be able to have that directory in place, not just for disabilities and mental health, but across each one of these new sections. So I think that was beneficial for those folks. One thing that was a good conversation was talking about redundancies that exist in the health and nutrition area, particularly when working with families and filling out forms and submitting documents and trying to figure out some shortcuts and ways to do that better. And then they sort of ended thinking about training. They zeroed in on some behavioral issues and then some obesity and overweight, how to talk to parents about that without offending folks. There seemed to be a lot of sensitivities around that, which you can certainly understand. So those were some of the conversations that the other two groups have had. And I think in some ways, there are a couple of items in here that mirror that. So these were the responses to the issues facing children and families. Now let's quickly go to what do we see as the challenges facing staff. And as you see here, we're going to see a lot of the same issues: burnout, limited personnel, staffing, consistent attendance of children, staff absenteeism, stress at work, not enough help, low pay, knowledge of local resources. So, we're seeing sort of a similar theme, if you will, in a couple of those areas that I think are sort of overarching across all of Head Start and not just isolated to one particular group or the other. And then the question of, if you could wave your magic wand and fix anything, regardless of people, staff, or time, what would you do? And so these are the responses that you all provided, those of you that were able to respond to the survey that you guys provided here. Make the referral process quicker and easier with faster turnarounds. More resources for families, students, and staff. All families should be able to meet the needs of their families, such as finances, childcare, food. Be nice for each center to have a mental health coach to assist staff with relationship building, looking at the root of behaviors. All Head Start programs, again, to have a Head Start manager, coordinator, conscious discipline, have a team of board certified behavior analysts on staff, availability of service providers to meet the needs of every child, and then additional staff into the classroom. So a few things here that are very specific to this area, and a couple of items that seem to be sort of overarching, similar to what some other groups have said. So having said all of that, are there particular issues when we think about disabilities and mental health as it works with Head Start and Early Head Start that we think are missing here? Or are there some things on this list that we really want to amplify? And so this is that part where I need to hear from you guys in terms of what do you want this group to focus on? What do you think our time is best spent on? And I know that's a big question.
I know in my area, I'm in Jefferson County, and I don't think it's county related, but just staffing shortages. And like what you mentioned before, just even with offering retention, even with offering, paying for schooling, credentialing, CDAs, things like that, it's just still a big issue that we cannot keep staff. And I don't know, I like feedback maybe just to hear from some of the other, grantees, what are you all doing to retain staff, to keep the ones that you have, and then to bring on new ones to fill the vacancy?
Great question. Sort of who's got some response to that? Are there any innovative things that folks are doing? Is there anything that folks are sort of trying right now to retain staff?
Well,
Are you experiencing the exact same problem?
just to kind of bank off of that, I was going to say, for us, I mean, for me, for staff, a lot of it's time management, being able to complete all the tasks that you need to do on a daily basis, because it's so overwhelming trying to get so much in. And being able to, and with staff turnover, being able to train your staff, having the time to do it, being able to pull them aside, set them aside, and mentor, with other teachers and so forth, so that they can gain that knowledge. But some of the things that we've tried, and we still, have quite a bit of staff shortage, is yard signs. Some of our staff have even taken yard signs home with them that talk about, are you looking for a position? Actually, I helped someone just yesterday. She said my neighbor had a sign in her yard, and that's how I, saw it. So I literally sat down with this lady, because she wasn't, a tech person. She was a little older, because that is a challenge that we're facing now, is getting people will not complete the online portion that they need to complete. So it's like an incomplete application. And so I sat down with her and helped her to complete that application fully. Another thing we did for recruitment of children as well as staff is send out postcards in the mail. We got the okay from the Postal Service. There was for a list, I think they had listings of children under a certain age if that family has a child. So we got postcards made that went to their homes, and we got some feedback from that for children. And once again, the online system is challenging for people whenever they're told apply online. So one of the things I think that we really need to do is open job fairs, like walk-in, where we can sit down with people and get people in that way.
Yeah, just to kind of echo both of you, in Northern Kentucky, we're having the same issues. We have quite a bit of staff shortage. And, I feel like we hire one, lose two. It's kind of been a revolving door, and it's something that we haven't experienced in the last couple of years. So it's been extra overwhelming, because we were fortunate enough to have very little turnover for a while, and then all of a sudden a lot of turnover. And I think a lot of it does come back to mental health and burnout, and just like staff not feeling supported and having like the proper training, because we're sticking people in classrooms as soon as we hire them, because we desperately need people. And the population that we serve, these are difficult kids sometimes, and we have a lot of challenging behaviors in our classroom that, my mental health and disabilities coordinator, she's doing the best she can. And our early childhood coaches, they're out supporting teachers as much as they can. But there's only so many of us and a lot of them. And when we're also filling in for vacancies and stuff, it's overwhelming. Some of the things that we have tried, and again, we're in quite a bit of a staffing crisis, so I don't know if it's being, if it's been effective. But one thing we are getting ready to start is we have contracted with, or we're working on getting a contract with a licensed therapist to work directly with staff. So we'll have them, we're contracting with them like 5 hours a week, like Tuesdays and Thursdays, I think, like after kids leave, at 3 o'clock, 3 to 5, 3 to 4. And then on Fridays, there's a couple openings as well. So staff can anonymously sign up for those services, and then use work time to sit and talk about issues. So that is one thing that we've tried. Obviously, our agency also offers EAP, but a lot of people there's a stigma with that for whatever reason, and people don't use it. So we're going to try this route. And then we've tried offering, with some of the childcare dollars that have come out, we've tried offering some bonuses. We offered a sign-on bonus this year with this year's contract. Wasn't super successful. And then we are trying to do some staff outings. Like we're working on like doing some kind of like pumpkin patch thing for families, or for our employees to bring their family and do kind of some team bonding there. So we're hoping that those things are successful, but those are just some ideas that we've had. And if anybody else has any ideas, please share them, because it sounds like several of us are in the same boat.
No, I'm the mental health consultant, so here at Carroll County, so I don't really hire people, but I do provide as much as I can support to the staff. And then I encourage and always have the EAP information outside and talk about that, try to really take the burn out of it. And I have some staff that use it and they tell people like, it's awesome during COVID because you can do Zoom and it's faster and easier. And, you know, some of them are really good to share that how beneficial it was to them. But I honestly think it's really, when a lot comes down to pay. I mean, when you see, we're outside of Louisville, you see people getting paid $25 an hour to work at the mall. I mean, it was 15 at Chick-fil-A. It's probably a lot more now. Ford's hiring, GE's hiring, UPS is hiring, Burger King's paying $15, $16 an hour. And I just think, I don't hire people, honestly, and I'm not involved in any of that, but I can't imagine that it's not beneficial to them to drive from even Carrollton for like 40 minutes to Louisville to make $20 rather than make 10 or 11. So I just think, it's the basics of life. If you can go make money, so much more money somewhere else, how do they turn that down when they're trying to feed their families, So I don't know. I don't hire people, like I said, but I can imagine that that's some of what's going on.
Yeah, and two, I forgot, I'm sorry, the gentleman's name, Joy, I'm sorry if I'm saying that incorrectly. To the point that he had made earlier is, and I don't know if this is just a venting session. I'm sorry if I'm just venting out loud. But yeah, with everyone really kind of just the consensus of what everyone is saying with the staffing shortages, I'm scared to anticipate when the vaccine mandate rolls out January 1st, what that will look like for our program. And I understand, everyone has their own personal opinions about it, but right now it's mandated and so it is required. And so, we're trying to urge that to our staff and educate them and bring in, nurse practitioners or anything like that we can to help people to ease their mind to possibly go forward with it. But already just getting the hesitancy that I'm hearing across, my program, I'm very scared to think what's going to happen in January if we're already not successful. I mean, because it sounds like everybody is doing the same thing, and I'm literally what you all are doing. I'm echoing that we're doing that here at our program also. So if we're not already successful to bring them in the door, and then we're going to possibly lose several more in the next few months. I'm very scared to see what is that going to look like and how that's going to affect us. And then FA2 is coming in January as well. So I just don't know. I don't know. I'm on my soapbox. Sorry, everybody.
Completely feel like our staffing, we have 16 counties in our staffing, depending on which area, the majority of our sites are really hurting for staffing.
Karen, you sound like a robot. Sorry. I know it's your internet probably.
You better the robot.
Yeah.
Go ahead, Christina.
Well, I don't know exactly what you were going to say about the staffing, but I know one thing that I wanted to bring up, which I agree with the, I don't remember her name, but talking about the pay and how that impacts staffing issues. But as far as addressing the mental health needs, I'm hoping this is effective, but one thing that Karen and I are working on together is implementing, working on teaching conscious discipline to all of the site managers in order for us to implement the structures throughout the agency in order to build an environment of safety and for teachers to learn, or all staff, not just teachers, central office staff, admin, everybody, whether it's a lunch person, whoever, to be able to learn how to use some of the structures and the skills to self-regulate so that we can help our children self-regulate. I know with teachers and staff in the classrooms, you know, stress, the more stress they're feeling, the more apt they are to use punitive measures. So we're wanting to make sure that everybody knows how to self-regulate first, because if you can't self-regulate yourself, you're not going to be able to manage the children. So Karen, you want to see if you still sound like a robot? Yes.
I typed in the.
Oh, you typed it in? Yeah, so Karen just said we even have staffing issues through our disability services such as First Steps, and it's near impossible to even get a referral completed.
We did this is Dawn again. We did a conscious discipline training at the beginning of the school year for all of the staff. Usually it's me having to do it, but we did have one provided to us and had paid for someone to come and use whatever funds that she used for that. And that's kind of, our center's smaller than it sounds like a lot, whatever you all cover. I mean, we have a couple hundred kids, but we use conscious discipline with Fidelity here. And so, but COVID has slowed that down quite a bit, because just the trainings in person, we have concern, even though we did the one completely together, but we also had some people sick that didn't know they were sick during those trainings. So I think I'm hesitant to do trainings in a group setting right now, because it just doesn't seem smart. I mean, we've had a lot of COVID at this center with staff, kids. It was out 50 days and got super sick. So that's kind of slowing up our trainings, because putting everybody in one room together is how we used to do it. So makes it a little hard.
Do you know, do they make that available virtually? I mean, I have to imagine that they do.
They did not.
But that particular one, they did not? Yeah.
No.
Our staff, we have an early Head Start in our Head Start that we actually spent the money for them to go to, to the online trainings, and the early Head Start, they have access to it for a year, which once again, kind of falls back to time management, because you have to provide staff time to do that. And so when they're with children so much, they've got to have that time to be able to sit back and do the trainings. I think they receive an email, the early Head Start, when it's finished, saying that it's completed, and the others got a certificate. But they have access to it for a year. And then we've also ordered some materials from Conscious Discipline. But wonderful resources. I think you're muted.
we had them come here, the conscious discipline person. And so we did it at the library, in a room at the library. So that online sounds great though, because they can access it. We don't have kids on Fridays, so they could do it on Fridays, but I know they have other things that they, have to do on Fridays too. So yeah, time is an issue.
What other issues do we have? So for instance, we've talked about staffing shortages. We've talked some technology challenges, mental health and burnout, dealing with challenging behaviors in the classroom. We've talked about pay, which I think will lead into our compensation and benefits study. And then we've just now talked about the need for training around conscious discipline. Is that something that everyone is doing now? Yeah. You might be interested, we had done a survey and I put it in the folder. So if you go back to the Google Drive, you should be able to see it in there. We did this survey last week and we had 17 of the grantees respond. This one dealt with how they're dealing with COVID-19 issues in the classroom. And then it asked other questions like, are you providing incentives to staff to be vaccinated? And then these were the responses from programs. Are you providing hazard pay? Are you doing testing? Are you providing staff more days off? So if you're interested in that, I put a copy of that in that folder so you guys can take a look at that as well. Because I know that as we're talking about sort of the vaccine and the mandate and the impact that's going to have on staffing, it very well may be that we see more programs wanting to do that. Okay, what other topics and issues do we have that we think we need to be focused on? And again, we don't have to have everything under the sun. That's oftentimes we don't want to be a mile wide and an inch deep. We want to really focus on some things where we feel we can make an impact or bring it to a broader audience. Do you want to see the lists again, or do you have them in front of you?
Well, John, one of the questions that I had was a lot of the survey responses talked about COVID as a concern to mental health and disabilities. So I just thought maybe we could discuss that a little bit.
Okay, excellent.
So I guess my question to the group is are you guys seeing like a lot of staff fear with COVID? Is it parent fear? Is it parents getting upset because you still have to send kids home when they're sick, or that there's, I think one of our staff's concerns is that there was all of these restrictions last year, and then childcare licensing pulled back all of those restrictions, yet we're in a place right now where COVID is really worse than it was last year. So there's a lot of disconnect, and we've tried to put some things in place. There's not that emergency COVID leave anymore from the federal government, but we use childcare dollars to offer that again this year. So what are you guys doing, and what are you guys seeing related to COVID?
If I can be honest, I mean, we've been covered up in COVID. Like I would say, most of our staff has had COVID. I mean, and it mostly came this year. And the few that haven't, I've seen more people motivated to get the vaccine because they've seen so much COVID around, and we've had lots of kids with COVID. We've had babies with COVID. First week, 2 babies had it, gave it to a staff member. I mean, I have been surprised by licensure. We're under the mandate from the school system, the Board of Education. So they've gone as far as, I guess, how that they have extra money from whatever to give us $1,000 if we don't take a sick day until January 1st. So we have people coming probably sick because they're incentivizing them to come to work, even if they're sick, by giving them $1,000. Now, they don't see it that way, but speak frankly, that's just the way I see it. And so it's been challenging. I do hear some younger staff. I have heard a little bit about people still threatening to quit, but if they have to get the vaccine. But I've actually seen more people that were really staunch in not getting the vaccine go ahead and get it since the mandate has come down. So I wonder how many are really going to quit because of the vaccine. There may be one or two here at this center, but we just haven't seen it yet. But they've only sent out one email and haven't followed up on it yet. So as we get closer, I guess we will see. But we even, like, I think if you were vaccinated, you got days to, if you got quarantined, no, or you didn't have to quarantine. I think what it was is if you didn't get the vaccine, you had to use six days to quarantine. That's how the school handled it. And it's not our Head Start, it's the county school that, you know, we're under. So that's how it's been handled here. So, I don't know if that's helpful or not.
Well, I would like to say for us, it's been parents. Parents have been reluctant to send because of the virus. And I can't say that I don't blame them. I mean, I'm scared that my child is going, you know, to high school. So.
What other issues?
I kind of wonder, like, the long-term effects of maybe getting through it this year, but what's kind of the traumatic effects that it's going to have on our staff and things as we go on, and how we can address that maybe not even next year. I don't know when COVID's going to resolve itself, but how we can address the stress that it's put us all under, because just recognizing that that's been stressful, and how we can support our staff do some of that later. I think we're still in it right now, but maybe long-term, how do we support them, including the helpers, like us helpers? You know, I was alone for 27 days at my house on oxygen. So I you know, even I needed help at that point, and I feel much better now. But how do the helpers help the helpers? You know, how do we do that as a team?
What else?
Well, I know that we say help the helpers or help the people that are, we had a food program where they could call in, and we would have our at-risk workers or whatever drop food off, whatever items they needed on their porch, and contacted them that way. If we knew a family that, I mean, we had one family, there was 9 people that had COVID. All, you know, the children, the grandma, the dad, the mom, everybody had COVID. So we said, you know, we want to do something. So that's one thing we thought we could do, is to provide food. That's what we did.
I did see somebody write a note about, it's almost switching, about First Steps not doing things in person, that they're just doing it virtually. I think that's kind of been an issue here too. Like, we're all here doing things, but some of our collaterals that we work with aren't, and you're talking like little bitty children that are hard to do things virtually with. So that's kind of been a struggle, I think, that we're having. It sounds like you guys are having that as well.
We've had, with one particular county, we had some staffing issues with our early Head Start and had to move to virtual services, and had several children that had an IFSP, and that I think out of 16 children in that county, about 6 of them had an IFSP. So of course, we were concerned about those services and set up for the therapist to come to the center, you know, because there was enough staff with a parent there to be able to do the services there. But then we had, you know, sometimes it's almost like whenever a family hears virtual services, it's like, oh, I don't really have to do much. So we've had, you know, struggles there too with getting set times for families to stay in touch with us and be able to go back and forth and provide those services, because we do have that sometimes with not being able to have contact with virtual services, making sure that that stays there.
We've seen an issue with just being able to locate mental health services or adequate mental health services for the age group that we serve. A lot of mental health therapists don't want to work with children who are under 5, or they are not adequately trained to work with children under that age group. And then also our rural areas sometimes have difficult time finding services.
I think one thing that might be able to help you with that, Christina, is what I do, because I'm a licensed therapist, but what I make the referrals, which I think is most appropriate, is you really can't do hard-hitting therapy typically with a 3 and 4-year-old. You could do play therapy. It's super hard to find a play therapist, but I make the referral under parenting, because what typically is the therapist needs to have eyes on that child and to kind of see if they've got some severe behavior problems or maybe autism or things like that. But at that age, it's really a lot of times about parenting if it's not a developmental. So I make the referral under, can you support this family with parenting skills? Because typically that's what's going on. I'm sure you guys know that. It's a lot of dysregulation, dysfunction in the family that then leads to, or ADHD or things like that could be involved in as well. But a lot of times it's about having that parent learn how to deal with whatever is going on. So because a lot of times when I first came, the therapist tried to come here to see the kids. And I said, no. I don't need you here. I need you at home. I made an in-home referral. I can handle whatever's here, but what I need you to do is help the family learn how to provide support, structure, encouragement, not be abusive, whatever it is that's going on in that home. So that would be an idea, is when you make that referral, say it's a 4-year-old, but I would like the parents to be involved in parenting. So maybe that would be helpful.
Yeah, I agree.
Are you all involved in any of the provider cafes that are offered for the state through the early childhood mental health consultants?
Yeah, I'm actually a host.
Okay.
So, yeah. Yeah, and I want to piggyback on what she said. Yeah, I completely agree. A lot of times working with those parents is key, because I'm a licensed professional clinical counselor as well. So I completely understand that. I guess I'm just coming from the perspective of, you know, trying to find, like you said, it's difficult to find play therapists who will actually work with the child as well. But I totally agree that a lot of times it is an issue of working with the parent when you're talking about children that young too. So, yeah. Yeah, but those provider cafes and director cafes are really, can be really beneficial to help people kind of connect and build connections and to get more, learn about more resources out there. So yeah, I'm glad you brought that up.
Do I find that like on the Head Start site? Where would I find those?
It was shared through the Division of Regulated Child Care to us. And we have like a group thing with our email. So I sent it out to all staff because they can get ECE TRIS credit for attending and they get a stipend. It's after hours, so we can't mandate it. But it's something that they can receive $30, I think, for the provider cafe. And then if they do the trauma informed care, it's a one-time thing, but it's $50. So it's an incentive for staff to be able to, join and be a part of. Emily, Kelly. Keely.
Yeah, I can put her email address in the chat if you want to reach out to her to find out more information.
I think a big problem, I don't know if anyone else has had this problem, but where we live, we have horrible internet service. A lot of our young children are being raised by their grandparents, and bless their hearts, they try, but a lot of them, they have no clue how to get on a Zoom meeting. A lot of them are scared to even try. I think that has really hurt the virtual in our area, even though they try to provide Wi-Fi with hotspots and everything. But this has really been an issue with us. We have tried to think of ways to get around servicing the children without, having to do a lot of virtual. I don't know how everybody else is, but we, like I said, the grandparents, we conference, we can phone conference, we can do things, but as far as, being on, and like you said, a 3-year-old child, it's hard to do anything with them when they're not there because, they want to be playing, they don't want to look at somebody on a screen. So, that's been a real challenge. I mean, if anybody can think of, anything more that we could do, we do. We send out, we do art supplies, we send to every child, and we've even try to do a lot of the tablets where they did have those if they needed them, if they could use them, but we found a lot wasn't being used. That's just what we found from last year, so. And like you said, with First Steps, a lot of our children that did have IFSPs before the pandemic, it all stopped because parents weren't, they wanted to do the tele-intervention. And again, we're in an area where, we have very limited access to, especially in the higher elevations, internet service, so.
Carla, we had the same thing. I had so many grandmothers that couldn't get on, and honestly, I couldn't necessarily help them myself. I'm just 2 steps from being a grandma myself. So, they had to send out the young staff to figure out how to Zoom and Google, and I had brain fog from COVID. I'm like, I can't figure that. It took me 2 hours to make myself into a Bitmoji. It was a struggle for me too. So I just provided lots of support to them and just took the pressure off, because I think so much of the pressure on the grandparents, it's hard enough to raise these kids. We're in the middle of a pandemic, and then we add the pressure where you need to get on and you've got to do this. And so I just tried to kind of help manage the expectations as well, because it was just so stressful for some of them to have that added stress.
Well, Tara, we have reached an hour, and my commitment was we wouldn't go over an hour, at least for this first conversation. We certainly can plan for more time in the future, but I think that I have got 4 pages of notes. And what I'm going to do is I'm going to go through and summarize our conversation and come up with and sort of extract from this. I think there are 4 or 5 different key things that are in here, key sort of major areas. So I'm going to put those together and I'm going to send them back out to you guys. And what I'd like you to do, I'm going to ask you in the email to sort of pick, if you will. We'll sort of decide what do we think are the top 2 or 3 that we want to focus on. There may be more. We may feel strongly that we want to focus on more than that. And then we can also decide when we would like to get together again. My thinking and goal right now is that these groups would get together 4 to 5 times a year. Right now, we're doing it remotely, but in 2022, hopefully, we will be able to do them in person. If we find that 4 to 5 times a year just isn't enough, we can actually get together more, depending upon your all schedules and your desire to do so. So we are continuing to invite those other Head Start grantees that have not yet made appointments to these groups to do so. So again, it's my hope that in our next conversation, we'll have even more that are present here with us. So any closing comments, any closing thoughts? Okay, well, I will send this out to you all. And Tara, anything to share?
Just wanted to say thank you all for joining. I think it was a great discussion, and I just really appreciate your input and feedback. So thank you guys.
Thank you all very much. This is going to be a good group. I appreciate all of your insight. So I will get this out to you later this week, and we can go from there. Thank you all so much. Enjoy the rest of your week.
Bye. Thanks, John.
Bye, thanks.
Bye.